Since I do a lot of penile implant surgeries, I do get a lot of questions on the internet about various doubts about the penile implants. So I shall answer some of these doubts. The question number one which many patients ask is, what is the cost of penile implant surgery in India? So again, the cost of a penile implant surgery depends on broadly or mainly three factors. One is the type of implant that you're getting it done, whether it's a semi-rigid or an inflatable one. And number two, the type of ward that you choose in the hospital, whether you choose a deluxe ward or you choose a general ward or you choose a suite room. Number three, it depends also on the expertise and the experience of the surgeon. So, for example, if you have chosen a deluxe ward and your hospital stay is around 1 to 2 days, a semi-rigid penile implant. In semi-rigid, there are two types. The Indian semi-rigid penile implant, the total package may cost you around 1.5 lakhs to 2 lakhs. And a semi-rigid penile implant which has a memory like the tube or from the Rigicon or from the AMS, which is the Boston Scientific, that is the Tactra, this may cost around 2.5 lakhs to 3 lakhs. Whereas the inflatable penile implant, that is the AMS 700 or the Rigicon or the Zephyr, may cost you around 8 to 9 lakh rupees. Again, it all depends on which ward you are choosing in the ward and how many days you are staying in the ward. So this is briefly the cost of the penile implant surgery at our center. So the second question being, how long do these penile implants last? So I said the semi-rigid and the inflatable implant. So semi-rigid implant, there is no much of a mechanism involved in that. So if you ask me, semi-rigid penile implants usually last longer, maybe 20, 25, 30 years it lasts, as long as the medical grade silicone quality is maintained. But of course, it's not under your control. As long as you keep a good health, if your sugars are under control, and if you're maintaining a healthy diet and so on, these semi-rigid implants do last longer. Whereas the inflatable penile implant, since there is a hydraulic mechanism involved, the mechanical device or the mechanical survival of the inflatable implant at 10 years is usually around 80 to 90%, which means if you do 10 inflatable penile implants, at 10 years, 8 to 9 implants will be working fine without any issues. So at 15 years, this rate drops to around 70 to 80%, which means if you have done 10 surgeries, 10 inflatable implants, around 7-8 will be working fine. The remaining 2 to 3 may have some issues which require a revision surgery. So that's how the penile implants last. And the third question being, can a penile implant increase the size? This is a very difficult question to answer. Of course, there are so many factors which will influence the size of the penis after the penile implant surgery. So there are some techniques, intraoperative techniques, which can preserve the penile length. But overall, in short, to say, a penile implant is not designed to increase your penile length. Although some newer companies claim to say that they will increase the penile length, but actually that doesn't happen in the real scenario. So please do not opt for a penile implant just because you want an enlarged penis.